watching Time Warner Cable News New York 1 all evening.
Addiction to prescription painkillers is a widespread problem. The Kaiser Family Foundation found that 44% of those polled said they personally knew someone who'd been addicted to painkillers, in some cases themselves. And the longer you take these drugs, the more likely you'll get hooked. The CDC estimates 1 out of 4 people who take a prescribed opioid consistently for several months will become addicted. But there are options for treating pain beyond these highly addictive drugs. Joining me now to talk about this is Dr. Lillie Rosenthal, a physical medicine and rehabilitation physician and a consulting physician for the New York City Ballet, American Ballet Theater, and several Broadway productions. Thank you so much for spending a few minutes with us.
Thank you, Tara.
So we're talking about this problem. We hear it all the time about people becoming addicted to prescription painkillers, and part of the problem is they're being prescribed so widely. Is it doctors who are quick to prescribe them? Is it us who are quick to ask for them?
Yeah, it's true. We have an epic socioeconomic problem, and it really is, just as you say, it's really a shared responsibility. It's doctors who are quick to just write a prescription. Patients are asking for something, right? They're consumers, they're asking for something. So it's doctors that are a little too quick to prescribe when they should be having a conversation. And quite frankly, yes, patients who just give me something I want to feel better immediately.
And that's just it. If we're in pain, right, we want the Band-Aid. We want something that's going to take that pain away. But really, pain has it's indicative of a greater problem.
That's exactly right. Pain, believe it or not, it's actually not a diagnosis. It's a signal and a symptom that something's amiss, that the body's out of balance. So we really need to find the root cause of the pain. What's actually causing the pain? That's important to identify.
So while we're going through that journey, and of course, hopefully some sort of rehabilitation afterward to correct the pain, there are some things that we could be taking, let's hope, that will avoid having to go on these prescription painkillers. So let's talk a little bit about some of the different types of pain that we could be experiencing and how we can treat those. Starting with, how about muscular pain?
Sure. Muscular pain is something I see widespread, and many other doctors as well. It's ubiquitous. It's, muscle pain comes from many things. It comes from, in our technological world, we're on the computer, we're holding our phones, so we all have muscle pain. And muscle pain, what I like to remind my patients is when we think about pain, we want to think about what we can do as individuals to help ameliorate the pain. And I tell them to remember Dr. Lillie Rosenthal, DLR, diet, lifestyle modifications, and in addition, relief remedies. So I like to talk about muscle pain and some of the things that we can do for muscle pain, dietary changes. A lot of us don't know this, but we need magnesium for our muscles to be functioning properly. And a lot of us are deficient in our diet in magnesium. And some of the things I brought with me today are nuts that have a lot of, eating nuts will actually boost your magnesium stores, as well as unsweetened cocoa powder, and flaxseed meal. So these are things we can do dietary. That's the D. L for lifestyle modifications. We really need to pay attention to our posture, because having strain, you have beautiful posture, but having strain on our muscles can actually create pain. And if we need a quick relief remedy, we can have, there's a product that I use in my practice all the time and for my family and friends. It's called Arnicare, and it's a topical cream. It's odorless, it's colorless, and you can put it right on the area for muscle pain, and it's very, very helpful. Also, the end of the day, it's so nice to take a bath, and Epsom salts, believe it or not, have magnesium in them, and it can be incorporated into the body.
So are these things we should be doing before the pain starts? This is something we should be doing preventatively, or is it something that as we're experiencing pain, we should turn to these?
That's a great question. The dietary part of it, we should just be eating clean all the time, eating really well, plant-based diet, not a lot of processed food. A lot of people don't realize the real connection between food, fuel, biochemistry, and our pain problems. But as I mentioned, the relief remedies we can use if we experience pain at the moment. So there's a lot of preventative things that we can do with lifestyle that can prevent the pain in the first place. It's not inevitable that we all will have pain.
How about joint pain? Because that's something a lot of people experience, especially first thing in the morning, maybe after you wake up, you have those sort of aches and pains.
Absolutely. Joint pain is so common, and a lot of people don't know this, but after the age of 30, believe it or not, we all have skeletal evidence of arthritis in our body, which doesn't mean we need to run off and replace our joints, but there are so many quick things that we can do that are super easy. And I brought some of them today, again, from a dietary standpoint. A plant-based diet. I have some Swiss chard and spinach with us today, which is a good way to actually eat an anti-inflammatory diet to keep pain at a minimum. So that's a dietary modification. As far as Exercise, huge to relieve joint pain. So we want to stay conditioned. Even a walk, an hour a day is important.
You know, it's funny because people, I think, when they're experiencing joint pain, they worry about exercise. They think, oh, well, if I start to overdo it, it's just going to exacerbate the pain I'm already feeling.
Yeah, that's a bit of a misnomer. It depends on sort of where you are and what your actual diagnosis is. But generally, a lot of people are afraid to move. They think they're going to damage something. So it's really important to define exactly where the pain is coming from. But in general, being conditioned will absolutely prevent joint pain. So that's important.
Another pain that people experience a lot of is headache pain, and certainly there's tons of over-the-counter options available for that as well, and I think people are very quick to turn to those when they're experiencing a headache.
Absolutely, but the better thing to do is really investigate what's happening in your life. We're New Yorkers, right? 24/7, we're on the move, we're not sleeping enough. Fatigue is a huge part of a headache problem. So is being dehydrated. Have a glass of water to remind us, right? We're talking all day, it's hot outside, right? It's summer, or it's getting to be summer, feels like summer. Staying hydrated is huge. I brought the daisy here to remind us that the arnica, which I mentioned earlier for topical relief, it comes from, it's called the mountain daisy. There's another product for headache, actually, that's called feverfew, which is an herb that can help with headache. The other thing for a lifestyle modification for headache is being relaxed. You know, taking a bath, maybe doing a self-massage for sort of stroking the muscles in the neck with some essential oils, which I brought. Peppermint oil, it's stimulating. Lavender can help us calm down and sort of get a really good night's sleep, which is important for headache control.
And obviously, very quickly, if you are experiencing some major pain, you do need to see someone at some point just to talk a little bit about what's going on. But it should be a conversation, as you said, as something to explore what's going on rather than just put a Band-Aid on it.
100%. Absolutely.
All right. Thank you so much for spending a few minutes with us. We really appreciate your time.